The following segment is being sponsored by El Paso Health. Today we're visiting Dr. Hector Ocarranza. He's a pediatrician. How are you doing, doctor?
Very good, and thank you very much for the invitation.
No, thank you, doctor. Today we're going to be talking about COVID and vaccination. Could you please explain to us, doctor, what is COVID?
Well, it is a very current topic, and that is great. We need to explain to the people in very simple terms that COVID is not another cold. COVID is not another flu. The COVID is more dangerous and has taken the lives of many members of our community. We need to do something about it, and even though people have looked for more information regarding COVID, we're here to talk to you in very simple terms about the COVID. What can you do to prevent the COVID, and how can you as a family, as a person, and as a member of this community can do to prevent the spread of the COVID?
Okay, and the spread of the COVID, doctor, I know it's very important to get vaccinated. I guess that's one of the first things we should do. There are this is something very important that we as a community need to do. I know I've heard a lot of people say good things about it, bad things about it, but even though I hear so many things, I need to do what is correct, right? I got my vaccination. I have my 2 doses. My children who qualified for it also have them at the house. We all have our vaccinations. Why is that important, doctor?
Well, vaccination is one of the tools that we have that prevents the COVID. Once we have the COVID, physicians and the healthcare providers utilize different medications that are going to help us treat the COVID, but unfortunately, many of us who had underlying conditions such as diabetes, high blood pressure, can suffer devastating consequences because of the COVID. Those complications can be prevented by simple things such as the vaccination. Vaccination at the initial of the pandemic was not available, but fortunately nowadays we have the vaccine available, and it has shown to be effective preventing the spread of the COVID. Also, more and more studies have shown the safety of the vaccine, which it has been doubted by many people, and that's why there's still fears. That's why there's still apathy. That's why there's still some hesitancy in people receiving the vaccine. What we have seen here in El Paso is that we're leading the state in regards to the vaccination. And what is happening in our community? A lot of the people has avoided hospitalization and death. That's the bottom line. And we can see it, you can see the numbers, you can see how people in Austin, Houston, Dallas are suffering because they're get hospitalized, they're having a lot of the complications, and there's not enough room in the hospitals. We know that El Paso has a very limited amount of healthcare resources, meaning there's not enough bed in the hospitals to care for those that develop complications due to COVID-19. So what is it that we need to do? We need to protect each other. There are simple steps that we can take to do that. Mm-hmm. We've heard from the beginning of the pandemic how we need to stay away, guard our distance or keep our distance. The use of the face mask, also that helps tremendously to stop the spread, especially when we're indoors, when we're with other people that might not be vaccinated. Washing our hands and keeping all the hygiene precautions that we have been telling, using hand sanitizer. But also, if you're sick, stay home. Mm-hmm. We understand that a lot of people need to work, they need to do other activities, we need to send our children to school, which is another one of the topics. But what can we do so that we can continue sending our kids back to school in a safe manner? If they're eligible, as you mentioned, your kids are vaccinated. If they're 12 years of age and older, get them vaccinated. If they're young enough that they cannot receive the vaccine, you as a parent receive the vaccine. We've seen that the parents are the ones that infect their children, and then they go to the school positive with COVID. So we don't want that to happen. We need to keep our household, and we need to keep our most precious things in our home, which are our children, safe and healthy. And that's the way that we're going to be doing it, by receiving the vaccine, by just keeping them home. Now that the school started, there's a lot of kids that are coming sick. And we need not to dismiss those symptoms that could be allergies, that could be another cold. It could be COVID as well. So
What would you recommend, doctor? Take them to the doctor as soon as they start having symptoms? Even if they seem like cold, like a simple cold symptom, could be something else.
yes, exactly. So you can just not send them to school. That's the most important thing.
The first thing.
And talk to your healthcare provider. Ask him what else you can do. You can go get tested. You can test yourself. 1 out of 4 people do not develop symptoms but can be spreading the COVID. That is extremely important to know, because people might say, well, I don't feel anything. Why am I going to be infecting other people? Well, 25% of the people are asymptomatic, or some other percentage can be in the pre-symptomatic stage, which is before you start developing symptoms, which in turn can infect a lot more people. So we need to continue to be aware that COVID is within our community. COVID is among us. It is something real, and it's not going to stop, and it's not going to continue causing complications unless we as a community do something. And what is it that we need to do? Get vaccinated. Continue wearing your face mask. Continue observing the safe distance or social distance. Wash your hands often and continue observing those hygiene precautions that we have mentioned before. And if you're sick, stay home. Simple as that. In our community, all those things have worked, and the most important number that we can give you, or evidence that all those interventions work, is that influenza, for example, last year the flu season dropped by 96% just by washing your hands, staying home, and wearing your face mask. So that's very, very important. People might not notice, and hey, I didn't get flu last year, and some people usually get the flu every year. But the same token, if you get your COVID shot and you get your flu shot, you'll be able to be protected.
Doctor, I feel that now that kids went back to school, we feel a little bit more of the freedom to go out to the stores, to go out to work, do other things that we weren't able to do before. If we're vaccinated, what precautions do we still have to take so we can keep our families safe?
If you're vaccinated, you still need to wear your mask if you're going indoors to those large places when there's going to be a lot of people. We need to continue protecting each other. You need to wash your hands. If you have somebody that is considered vulnerable living in your same household, such as your grandparents, great-grandparents that have a lot of those medical conditions, there's plenty of people that have cancer that are going through treatment. We need to be extremely careful. We need to keep them at home. And if we go and get the groceries, we need to go get some of those essential activities. Then when we come back, wash your hands, continue wearing your mask, and that's the way that you're going to be keeping your loved ones safe.
Okay, so let's learn from the expert. And thank you, doctor, for this interview. We hope to see you again soon.
Thank you very much, and thank you for the audience for allowing us to go into your house.
Thank you.